We're going to do a little bit of a recap of what we've done so far and then finish off the maxillary. And the reason why I left it is because the ophthalmic was pretty complicated, but the maxillary needs a whole session really. So we're going to do that. The mandibular, so when we get down to the bottom part of the trigeminal nerve, that's not too bad. That's okay. And there's some really funky stuff that goes on with that. So we'll cover that next week. So a couple of things if you've not seen it. If you wanted to take a screenshot of this, pause it so that you can use it for revision, then that's cool. So what we've got the cranial nerves down the side. I just go over these again, where they come out, the names of the nerves, and then what type of nerve it is, whether it's a sensory nerve, whether it's a motor nerve, or whether it's both. Then we've got what does it do, and then how you test it. So that is a really handy kind of revision tool for things. So you can, and in clinic, I have one of these in my clinic room because there is no way that you can remember everything in the whole thing to do with cranial nerves and the rest of the body as well. So, and you don't want to miss anything. So you can use this, you can screenshot it, laminate it, print it off, and then you can have it in your clinic room. And if somebody has got some weird sensations with anything here, because this is what these nerves do, then you could be suspicious along with other symptoms if there's a cranial nerve issue going on. And then obviously that would be a referral unless you know how to test. So yeah, this should help you. So we had to do this for our osteopathy exams. I know it's definitely covered in physio and chiro as well. So if you're doing any of those courses, then this will be quite useful. A couple of things if you've not seen this before, to remember the cranial nerves, there is a little kind of mnemonic that you can do. So next to each nerve, I've put the thing that to help remind you. So the first three are ooh, 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 and then it's to touch and feel. Very green vegetables are ha. Then you've got what they do. So some say money matters, but my brother says big biceps matter more. So whenever it is an S at the beginning of the word, then it's a sensory nerve. Whenever it's an M at the beginning of the word, it's a motor. And then if it's a B, then it's both. That's what those mean there. Then we've got different types of nerves, and we covered this on the first session, so I'm not going to go over that too much today. And we've gone through each one as well. If you've not seen it before, this is your first kind of live session with the cranial nerves. That's what that means. That's why we've got that there. Cool. Right, let's just jump back to this. So this bit is the trigeminal nerve section of that table. As we go through, I'll just extract a bit, and then we'll go into the detail, and then we'll back out again into the next one, back out again into the next one. So that's how I've structured it. So we've got the nerve number, so they're in Roman numerals, so this is number 5, so obviously a V. We've got the skull exit points, and we've been looking at these over the last couple of weeks. So the superior orbital fissure, which is a kind of crack in the skull, which is behind your eye, so in the eye socket, and that's where the nerves from your brain go through to get to the front of your head and to your face. So that's one of them. We've got foramen rotundum, which is a round hole, and then foramen ovale, which is an oval hole. Those are the holes for the trigeminal nerve. It's trigeminal because there are 3, and we've already covered this one, the ophthalmic. Okay, so I'm going to literally briefly go over that because we did a whole session on that before. We're going to focus on the maxillary today, and then next week we'll do mandibular, and then that'll be trigeminal done, and we should be able to start on the facial nerve next week as well, which will be good. So sensory, motor, or both. Well, this mnemonic starts with a B. So it's both 1, 2, and 3. So these are the different branches of the trigeminal nerve. They are so 1, 2, 3. So ophthalmic, maxillary, mandibular. All of those are general somatic sensory. There's sensation. And we've also got number 3, which is the mandibular, which is a special visceral motor. What it does is sensation to the face and mastication muscles, so the muscles of chewing. Okay, and then the way to test it is sensation to the face. So we'll look at the tests once we've done all 3 branches, and then you can see why we do the tests in the ways that we do. This is a summary of everything. So 5 trigeminal, it's both, so sensory and motor. It's general, somatic, sensory, special, visceral, motor. That all of the information about this nerve on one slide. And this is the mnemonic. Some say money matters, but this is this one. My brother says big biceps matter more. So this is 1, 2, 3, 4, 5. And that's why that's the B there. So again, if you've not seen it before or just catching up, that's what all of that means, is to help you remember stuff for exams if you're doing exams. If you are like me and have a memory like a sieve, then I need things written down so I don't forget them, and I just need just a tiny little reminder, and then I remember what to do. That first sheet, that should be all you need. Cool. So let's just go over this again. So the trigeminal nerve splits into 3 branches, hence the name tri. This is cranial nerve number 5. We've had a look at the ophthalmic, which is purely sensory, and then the maxillary, which is the one we're going to have a look at now, which is again is purely sensory. It's only the mandibular branch that has got motor aspects to it, so those visceral motor. Sensory, and then sensory and motor here. So we're going to follow the pathway of those. So it's sensation for your face, the nasal cavity, the cheeks, the lips, the skin of the mandible, and then muscles of mastication. So the anterior belly of the digastric and the mylohyoid muscles. And we covered those when we looked at the hyoid in detail a couple of months ago. If you've not heard of those muscles before, we've done a whole section on the hyoid, and I think that was a couple of episodes as well. So yeah, the trigeminal nerve innervates these muscles. That's just another picture, just showing that. So I think this is from the Anatomy and Physiology book by Grabowski or something like that. I can't remember what it's called. I'll put it's a red one. I'll put a link in the group when we're finished today. But that's a really good book as a summary of everything as well. These slides are a combination of a few things. There's a neuro testing made easy book, there's an instant anatomy book, and then the principles of anatomy and physiology. So it's a bit of an amalgamation of all of those into one. All right, so I've tried to merge everything together. So yeah, so we've got these 3 sections. We've had a look at this green section already, so that's the ophthalmic branch. Yeah, so 3 branches, mixed cranial nerves, 2 sensory, 1 sensory and motor. So 2 sensory at the top, and then the 1 sensory and motor down here. Already, hopefully, you'll be thinking, okay, if I wanted to test the sensation of the ophthalmic branch of the trigeminal nerve, then I need to do something to test the sensation to this part of the face. Hopefully you're thinking that already, because that's all it is. If you understand what they do, then you can understand why you do the tests a lot better. It just makes sense, and the reasons why. Because when I first learnt it, I knew how to do the testing, but then I didn't really understand why I was doing what I was doing, because where does it go? Why do I do that one for that? Which branch is that one? And I didn't really get it, so I had to really delve into it to understand it. So that this is the largest of all the cranial nerves, and you can tell because of how long it's taken us to get this far already. So we're on episode 4 and we're up to cranial nerve 5. So by the time we get to next session, we should do the last of 5 and then into number 6 as well. So, and then the next few aren't anywhere near as complicated as these, which should be a bit easier. We've looked at the ophthalmic, a sensory for the skin over the upper eyelid, the cornea, the lacrimal glands, which are your tear-producing glands, the nasal cavity, so inside your nose, the nose, the forehead, and the anterior scalps, or the skin of that area as well. We've covered that already. That's where it went through, and that was the tube map. So yeah, sorry about this, all this information. This was probably one of the best books that I got when I was studying this kind of stuff, and just muscles in general, really. It's called Instant Anatomy. I'll put a link in the group the other day. And it just sets everything out really nicely. And like I said on the last session, this is not how it's laid out in the face. It's not laid out in neat lines and that bit goes there, that bit there. That, you know, things go all over the place, but they've kind of plonked it down. It's like the tube map, yeah? So the tube map doesn't look like that. It's just put that way so it's easier to follow everything around. So this is a really, really nice, simple way of looking at it. And what you'll see are these little circles here, which are really, really useful, because this is where the nerve passes through something. Okay, so if it's got an area where it goes through, then it will list what the area is and then show what goes through that particular area. So yeah, these are all the areas on the ophthalmic branch, so the upper branch of the trigeminal nerve. Okay, again, not going over that today, just a quick recap. So what we're looking at today, and we briefly started it last time, is the maxillary nerve. So this is the next one down. That's that pink zone just here. So we've got sensation for the nasal mucosa, the palate, the pharynx, the upper teeth, the upper lip, and the lower eyelid. All around that middle section of the face is the maxillary branch of the trigeminal nerve. These are the exit points. Obviously, we've got the base of the skull and then the brain sitting on top, and we've looked at where the nerves exit the brain. They're numbered in order from anterior to posterior. Number 5 is kind of midway, where it comes off of the brain or the brain stem. And so the brain would be sitting on here, and then the branch of the nerve goes through these gaps just here. This is the foramen rotundum, the round hole, and there's a round hole in your skull, which it's really, really close to the superior orbital fissure. I'll see if I can show you on my model. I don't think it's that clear. You can just about see it there. I don't know whether you can see it there. Yeah, you can. Kind of there. You can see it's really, really round. It's obviously round, that one. That's the foramen rotundum. If you get your skull off your mannequin, take the skull off and then have a look on the inside, and then all of these little holes and nooks and crannies here, there's a reason for each of those, because of the exit points for either nerves or arteries, and you can track where each of them goes. You'll see on mine, it's got everything's labelled, so it's got little numbers on. This is from 3B Scientific, and they produce these really good quality ones, because I've had some skeletons that you get just off eBay for 50 quid and they break really easily, and I needed a hanging skeleton rather than one with a pole up its bum, so I can maneuver him around. This one was quite expensive, but because they label absolutely everything, and they've got areas here where the origin insertion of muscles are different colours, and then they're labelled as well. You can see the broad contact to that muscle and then where it attaches up here. You can follow things around on these skeletons really quite nicely, and you obviously get a book, and every number it tells you what goes through the hole or what muscles they are or whatever it is. So yeah, really, really good resource if you want to invest a bit of money. They're a few hundred quid. I think my skeleton was about 500 quid, but doing what I do, I needed it. So, but yeah, if you want to know these kind of things in detail, then that's a really, really good resource. So yeah, hopefully you can see on the video, we've got this round hole, so that foramen rotundum, and then you got the fissure above it, which is where the ophthalmic branch came through. And then the foramen rotundum exit is up here. There's your jaw just there, and that bit there, that's your cheekbone. So that bit there. You got the zygomatic arch, and then just underneath that, that's where, so up under there is where your trigeminal nerve will come through. Here we are again. We've got another tube map. Let me just make sure that's all locked in. I'm just going to make this a bit bigger so I can see it on the screen. There we go. I've laid it out exactly the same way again. I didn't go into too much detail on this on the last session because it was just towards the end. This is the reason why we have to split this up, because this maxillary branch has loads of other branches. They're going off all over the place. If you have a look here, that little circle there, that's your foramen rotundum. That's the bit we were just looking at in the skull. The nerve coming off of the brain, and then as soon as it exits that foramen rotundum, it then splits and it goes off. We've got an inferior orbital fissure here. We've got a branch that goes off there, and then we've got a zygomatic region. That's to do with your cheekbone, because that's the zygomatic arch. And then we've got branches going off to the lacrimal gland and then off to the skin all around your cheek, around that area there. This is the zygomatic branch, lacrimal for tears, skin of the temple and cheek. It's all around this area here. As soon as it comes out, there's a zygomatic branch that comes up there. So we'll have a look at that on the videos in a sec. We've got an infraorbital. Anything with infra means inferior, so below. So you might have heard of infraspinatus muscle, infraspinatus. That's inferior to the spine of the scapula. And then supraspinatus is superior to the spine. This is infraorbital, so below the eye socket. The infraorbital branch. We've got alveolar nerves, which supply the teeth and the nose. If you have a look here, there's a little fissure, which is right in here, where the jaw attaches. We'll have a look at that. To go maxillary fissure, and then this infraorbital branch goes all around here and supplies these top of your teeth all around there. Okay, anything that affects the trigeminal nerve at the back of the eye socket can then affect the sensation in your teeth. And again, I mentioned about the head injury that my wife had, and she's lost sensation in her teeth and on the roof of her mouth, because she had 4 eye socket fractures. She had that damage to that orbit, and then just lost sensation all there. And it's got a bit better, but it's not returned. So after nearly 3 years, that's it. She kind of has to live with that now. But yeah, that and it's obvious. Yeah, so whenever she's seen a specialist and she's talked about her symptoms, immediately they're like, oh yeah, we know what that is. And it's the maxillary branch of the trigeminal nerve. Yeah, so it's you can tell, because it's just knocked that section out. Then we've got down here, we've got other foramen going through here. So these are deep within the skull, and then we've got palatine branches as well. So nasopalatine for the nose and the palate, the roof of the mouth and the inside of the nose. Greater palatine is the nose, and then lesser palatine is the palate. All that kind of roof of the mouth area is supplied by the maxillary nerve. Let's have a look at that. Let's go to those. We started to watch this on the last session, and we're going to finish it off now. I'm going to pause it at certain bits, and then we'll explain it, and then where it links back to what we've just seen. So the maxillary branch, side view of the right side of your face. You can see the eye socket just here, and the nose, or where the nose would be, all of the right side of your teeth, the upper part of the jaw. That's where your mandible joint is. So the TMJ, temporomandibular joint, is just there. Yeah, we've looked at some of these areas before. You can see already there's these little cracks in here, and you may have just looked at a skull model before and not really paid attention to those areas, but these cracks are really important, because that's where the nerves will come through and then provide sensation to these areas. So this is from that original that grid. Okay, so we've looked at this one, we're now focusing on this one. So number 2, maxillary, foramen rotundum, round hole coming through the skull, maxillary, and it's going to be general somatic sensory. Okay, because it's number 2, it's only number 3 that's got visceral motor. So it's going to be sensation to the face, because this one's purely sensory. All right, so we're going to have a look which bits of the face it provides sensation for. Hopefully, there we go. Okay, so there's some other little cracks in it. Let me just hold that there. So this is that pterygomaxillary fissure that I just pointed out earlier. So that circle bit there on the tube map diagram. So pterygomaxillary fissure is just there, and then you can see the nerve that comes through it. We'll have a branch of a nerve coming through here. That's the first bit. There's your sphenoid bone. All that orange section is sphenoid, and then your maxilla bone is all the yellowy section. And then there's the fissure between the two. There's a gap between the two where the nerves can get through and then supply that region of the face, just above the teeth. If we have a look, I don't know whether you can see it on yours. It's really blurry on mine. I think it's just my screen, but hopefully it's a bit clearer. But you can see the alveolar nerves just here. That's what comes through that point just there. We'll have a look at those in a second because we'll layer the anatomy on in a sec. But the thing with this is it's continuous. So you got this pterygomaxillary fissure here. It's continuous with the infraorbital fissure, which is another branch. So that's this bit. Okay, so this little branch here, that will come through there, and then this bit here, the infraorbital, will come through here. Okay, so that it shows you, because of the different parts of it, will show you where it comes through. In fact, there it is there. Okay, so there's your infraorbital fissure. We've got sensation for the skin and the upper teeth around that area there. So the nerves that come through that bit supply this area all around here. Inferior orbital fissure, and then that's it there. So there's your superior one, and then there's the inferior, and you'll see the foramen rotundum in a sec. There it is there. Okay, so that's the round hole. Mandibular nerve comes out there, and we'll talk about that next week. And this is it in real life. Okay, let me just pause that there. Apologies first thing in the morning, seeing someone's face. It's the only way we can do this really, because you need to see the layers that you need to go through to get to these nerves. So to get to where the bones emerge, there are lots of layers. Okay, so apologies in advance. But yeah, we can see that this is around the cheek. Here you've got the lips and then the nose. We're going to be focusing on this area just here. There's your masseter muscle. You take that away and then you can see the start of the mandible, so the jaw bone just here. Okay, this is the temporal fascia, so the fascia on the side of your head. I'm just going to take that one away as well. And then there's your zygomatic arch. I've tried to overlay these with pictures as well to show you. This is your cheekbone. That's your cheekbone all along there. So if you had a feel along your face, that would be that bit there. And there, so that's that bit just there. And then if you drop down, then you're on your masseter. So if you grit your teeth, you can feel the masseter muscle tense up underneath your fingers. And then if you took your masseter muscle away, then you get to the bone underneath, which is your mandible, your jawbone just there. That's where we're looking at the moment. What they've done now is they've taken away the zygomatic bone. They've taken away this bone here, and then underneath that you've got this huge muscle called temporalis, which is another muscle of mastication. It helps to open and close your mouth. So if you put your hand on the side of your head and clench your teeth, you can feel the temporalis contract. And if you've ever done any courses in Indian head massage, that kind of thing, then you probably will have heard of that before. So temporalis has now been removed. Let me just pause that. Stop going there. They've taken the temporalis off. So now we're on the skull. We're on the skull up here, this bit. That's where the zygomatic bone would be. So this bone, okay, but they've taken that off as well. And now we're onto the mandible, this bone here. So it's showing you how many layers they've had to get through to be able to get to these structures underneath. Okay, just going to pause that there. You've got some other muscles that affect the jaw as well. Some of them are called pterygoids, and these are the lateral pterygoids. They sit right up underneath here, and they also help with chewing. We've got, you can see the lateral pterygoid just here, and you can just about make it out on the picture just up there. So I've tried to hide that part of the mandible so that you can see that bit up there. Okay, but that's your lateral pterygoid, and we're going underneath that as well, so we're going to need to take that away. There we go. The only bit left from all the other stuff that we're just seeing, because this just looks like a mess now, that bit there is part of your mandible. And what they've done is they've removed a section, the section that connects into the TMJ, so they've taken that away. They've taken away the zygomatic arch and then all of the muscles over the top of that. We're really now deep into the face here, and you can start to make out these structures just here, and we're going to follow those because those are the nerves. There's your sphenoid bone, and that was the bone that we saw earlier on the very first images. That's that section there. And remember, there was a pterygomaxillary fissure just up in here, and that's where the nerve starts to come through, or a branch of the nerve starts to come through. There's your maxilla. This is the bit that is on the front here. So this is where all your teeth will attach into. So that's that bone just there. So we've got the sphenoid bone and then the maxillary bone or maxilla bone just there. And then just up in there, we will start to see where the nerves start to emerge from. Your medial pterygoid muscle would be here. You might have heard of people doing some intraoral manual therapy. So obviously you need to be trained in it, need to wear a glove, definitely. But some people who have lockjaw, you can do some like trigger point type technique where you're basically pushing and holding, and you can put your thumb or your finger onto the pterygoids inside the mouth. We do get trained in that in osteo. I think chiropractors do it as well, and some TMJ specialists will do it. But you can have some quite amazing effects immediately on people whose jaws are just locked. They literally can't open them. And then if you can get a finger in, then you can get onto those muscles and do some manual therapy, just holding basically. But that's your medial pterygoid. Buccinator muscle. So this is one of the muscles that is really useful for Botox, because it's one of your like snarling type muscles, because it attaches onto all that area of your lip, so the lines around here. Here we go. This is your foramen rotundum. We've looked at that before. There's your foramen ovale, so that's where the mandibular nerve will go. And this is what we've seen before with the ophthalmic. There's the ophthalmic, that goes through to the front and onto the forehead. And then there's your maxillary, just underneath it. There's quite a chunky nerve there. That's your foramen rotundum underneath there. That hole there, which is what we had to look at previously. So that's where it's going through, and then we're going to join it up to the other side. And there it is there. We had the supraorbital fissure, superior orbital fissure, and then the infra underneath it, and then in between the two you got the foramen rotundum, and that's where that particular branch will come through. It's coming through here, and then we've just seen all of the tissue being removed from the side of the face around here, so that's it there. We can see where it's starting to come through. There it is there. There's your maxillary nerve, that kind of big blobby branch of it, and the foramen rotundum's up there. All right, that's, where is it on here? That's that bit there. What will happen is it will pop out there, and then it will split and then go off to all the various places where it needs to go. So we're going to have a look at where it goes. But you see, these are really, really deep structures. Infraorbital nerve, I'll just pause that there. That was this one. So that's the infraorbital nerve. And then it goes through that infraorbital foramen and then to the skin around the nose and the lip, the upper lip area. That was the one that we saw before. There's your infraorbital fissure, and that's where it will come through. Let me just rewind that a second. Just do that again. Pause that. Infraorbital nerve. Coming up through there. I'm just going to pause that there. Infraorbital nerve runs along the base of the eye socket. It will come all the way along the base of the eye socket. It's mad to think, isn't it, that you've got these nerves that are like sitting underneath your eyeball. It's a bit bizarre. And then look at that. There's a tiny little hole in your skull there. It's not on... I don't think it's on my model. No, it's not on my model. But you can see on this one there's a number just there. There is a hole in your skull about there. Okay. And if you push into there, it can be quite sensitive. Yeah, you push elsewhere and it's not too bad, but you'll get to a point it's like, oh, that's not nice there. And that is that bit. That's that bit, that infraorbital fissure. And that's where the nerve will pass through and then into the skin on for your upper lip. We've got another few branches there, but it supplies this region here. So when you're doing your testing and you're using cotton wool or whatever it is to test the sensation of the face, if they've lost sensation of this region here, then we know it's very likely to be this infraorbital branch of the maxillary branch of the trigeminal nerve. Okay, nice and easy, isn't it? But basically you just know something's not quite right and send them off to an ear, nose and throat specialist. Yeah, then we got your alveolar nerves, which we were looking at before. Just follow those through a second. There we go. Yeah, they go posterior superior alveolar nerves. These are branches of the maxillary nerve again, but it's these ones here. What I've done is I've just labelled these ones up here. We've already followed this infraorbital and we've gone through that infraorbital fissure and then it supplied the skin on that lip and the teeth. But we've got branches coming off of that infraorbital, which are these ones here, which then come down to supply these areas here. It's all around this maxilla area, all around there. These are all branches of the maxillary nerve. Just going to pause that there a second, just saw a question. Where did you get the diaphragm from, please, as I can't read it? Yeah, that is from Instant Anatomy. Okay, and if you go back to the beginning of the session, on the PowerPoints, there was a bigger version of this. And hopefully that's a bit clearer. If it's not, let me know and I'll put one in the group. It goes into the maxillar bone around here, but underneath that zygomatic arch. Underneath there's your maxillar bone, so the nerves are going into there. This area here. Yeah. Right. If I press play, yep, there we go. And then you've got branches that are running actually in the bone. They run in the bone and go towards the teeth. They're completely protected. They drop actually like in the middle of the bone of the maxilla and then go into your teeth. All right. And this is really interesting because that happens in the mandible as well. And we'll see that when we get to that section. They come up around there. And then we've got different branches. The posterior and superior alveolar form a loop within the bone. So it's gone into the bone and then it loops around all the way around the maxilla, all around this area here. So the kind of top part of the teeth. And then we've got your dental branches. These are supplying the sensation for your teeth. And then, yeah, hopefully you'll be able to see this one. These ones here, these are the lower branches. Remember we was talking about the palatine branches for your palate and the nose. So this is the nasopalatine branch. So the nasopalatine nerve emerges from here. We've got this foramen just in there. We're going to have a look at that one as well. This is another branch, sphenopalatine foramen, so a hole. And there it comes through there. You can just see that they've poked something through there. And again, it will come down and it will supply all this region here. Again, that's from that original image in the PowerPoints. So we've got the greater and lesser palatine. These are the palatine nerves, greater at the front, lesser at the back. And they come through this foramen in the top of your, the roof of your mouth, basically. They're traveling within the bone. Really good protection for those ones, and then supplying roof of your mouth and your teeth. And there it goes, look. It's coming through there and then it spreads. Greater and lesser palatine foramen, there's a hole in the top of the roof of your mouth. It's just absolutely mental, the detail around this area. And then we've got branches as well. So remember, it was nasopalatine. So we've got nasal branches as well that supply the back of the nose, so the nasopalatine area. And it's mad because this region, like I said with my wife after her head injury, this is the exact region where she has loss of sensation. If she pushes on the roof of her mouth, then she feels sensation in the back of her nose. It's really, really weird. Just after the injury, she couldn't eat anything solid because it would feel like it was blocking her nose up. And so I had first-hand experience with things that affect this particular branch. But there's the nasopalatine nerve where it comes through. And then that will then supply all the back of the nose, all around here. It's all the lining of the nose, and there's a little branch as well that comes through into the top of the roof of the mouth as well. Hence nasopalatine. And there's a little zygomatic branch. This was the top branch of that original image. And this is supplying all around this area here, so the temporal bone. And we've got areas where it exits there. So that was the nasopalatine, so it's supplying the nose and the palate. Just that front part of the palate there, and then you can see tiny, tiny little holes on the outside of the orbit. This is the zygomatic branch, that top area here, and this then supplies the skin around the outside, around the temple and the outside of the eye, just there. It's really, really complex, that one. Let me just go back. This was the original one. Hopefully you can see this one a little bit better, but this is basically what we've just been having a look at. That was the last one. That was the zygomatic that came out around here. Skin of the hairless temple, skin of the upper cheek, all around that area there. Then we have the infraorbital. So this was the one that supplied the top of your teeth and the skin for the cheek. Remember there was a point that is quite tender around there. Nasopalatine was the one at the back of the nose. It goes to the mucosa of the nose and then the roof of the mouth. And then there's your greater palatine, lesser palatine, which supply the roof of the mouth. If anybody has had a bang on the head and then or headaches or whatever, and then complaining of anything to do with weird sensation in terms of taste or teeth or loss of sensation in the face, then you should now have a bit of an idea about where it's coming from, because it literally it's like an electrical wire. So if you imagine that this was a light and then there was something wrong down here, then the light wouldn't work, and you're thinking, why isn't the light working? I'll change the bulb. And then you change the bulb and it still doesn't work. You have to track along. Let's try this bit, let's try that bit. and then you eventually get to where the issue is. So yeah, that's basically what neurological testing is like. It's like testing a big wiring system. That is the maxillary branch of the trigeminal nerve. So you can see the amount of layers that we had to go through and the amount of tissue you had to take away to get to the depth of those structures, and then where they come through and where they emerge through bits in the bone and little holes in the skull. There are specific pathways for these. And when we were last in the labs in Kiel, we were able to see some really good examples of where these nerves come through the face into the skin. So if you do get an opportunity to come with us to the labs, then you will see this kind of thing.